Started. My name is Heather Best, for those who don't know me, and I'm an occupational therapist that has worked on the team at Children's Hospital for quite a long time. I just wanted to open it to the panel to introduce themselves so that you know kind of who is here and get your questions ready for later on. So what we're going to do is introduce ourselves. I'm going to do just a brief kind of run through of some of the common issues and some solutions that we encounter at Children's Hospital, and then we're going to open it up at the end for questions from you. So please make note of your questions.
I'm Kristen Houghton, and I'm one of the rheumatologists at Children's.
I'm Kelsey Kamestik, and I am a JIA patient. I was diagnosed with polyarticular JIA when I was 14, and I'm also a graduate student at the Alberta Children's Hospital in Calgary, Alberta, where I work with research examining barriers at school for children with arthritis and developing solutions.
I'm Colleen Castagate. My daughter Kaden is 11 and she was diagnosed with JIA when she was 3. I'm also a vice principal in District 43.
Hi, my name's Sarah James and I'm the current occupational therapist in the rheumatology team at BC Children's Hospital.
So let's start with an overview of what some of the common challenges that we hear about from families. I guess more of as an introduction to some things that are really important to, or just to know who the teacher is that you're dealing with. And also, if you need to, who the administrators are at that school, because they're the ones who truly are the gatekeepers for these school supports that we're going to be talking about today. The role of the occupational therapist and even the physicians that are here are to help the family, hear their concerns, help them identify some problems that they might be having at school, sometimes extrapolating a bit from the different joint disease that we see in clinic and what that might mean function-wise at school. But really it is up to the school administrators to apply for supports and resources, and we'll speak to that a little bit later. It's really important as well to get documentation from us. I've brought a copy of our school checklist that just identifies some of the different things that we would recommend the school consider. But again, it really is just our job to make recommendations to the school. And I have copies of that up front if you like. So these are some of the issues that we see and we hear about that really affect kids' ability to participate. And I'm going to sort of speak to all ages first, and then break it down, because in elementary and then in high school and middle school, sometimes there are different impacts on a child's ability to function. So certainly morning stiffness is huge, so that might be something to really advocate for at the school in terms of what classes your child has first, if there's some wiggle room. So for instance, in high school, perhaps having PE class in your first block is not the best choice. But also just managing to get to school on time. So educating your teacher, having documentation there saying, look, if the child's a bit late, this could be the reason why. Are there things in the classroom that they can do to help the child manage that stiffness? So whether it be stretch breaks or even having a hot pack or something like that for whatever the child is comfortable doing. So obviously, managing pain. There are lots of non-medicinal pain management coping strategies, and that's a lot of what the occupational therapist and the physical therapist speak to as well. But again, it is important to be giving the feedback to the physicians if your child is in a lot of pain, and that's really indicative, could be indicative of a flare as well. Having enough energy to get through a whole day. Is there a way that the child can take rest breaks? Is there a nurse's office or a little quiet place at the school that we could advocate that your child has access to, just to break up the day? Because for some kids, a full day of school is really, really difficult. Participating in physical activities. I know Dr. Gershman spoke to this in the JIA lecture, that we really encourage all of our kids, regardless of their diagnosis, to be physically active because it's so good for them. And also it helps them to feel better and be stronger. Psychosocial element to school attendance, which is why we really encourage kids to attend school, and also just having that participation and that shared collective student experience. Stairs are a big one, especially in high school. Often there are lots of stairs. It's very rare, in my experience, for a school not to have an elevator somewhere in the building. Where your child's classes are, it might be a longer walk for them to walk to the elevator and then to their class than for them just to manage the stairs. But that's a really good one to explore. Some elevators require a key from the administration staff as well. Navigating uneven ground, so especially in PE classes that are outside, for kids who are playing with their peers on the playground. So that's where you really want to make sure you're just really simple things too. Your child is wearing really good footwear. Do they need orthotics? Do they need some kind of an ankle brace? Those are all things that you can come to us to talk about as well. Having enough time to complete tasks and homework. So fatigue is kind of the silent, unseen struggle that a lot of kids with rheumatic disease have. And that's something that the teachers need to advocate for and educate, and that we can provide documentation around that too. Sometimes it's a real barrier in high school for kids to complete their homework or big projects and things like that, because they just aren't able to stay up late enough and concentrate well enough to do it. So obviously, if your child has arthritis in their hands or their wrists, writing and even typing sometimes can be really difficult. So that's where we can advocate for use of a laptop or use of other technology or a tablet. Even just talk to us about different adapted writing implements, like different pen grips and things like that. Copies of classwork for classes missed. That's huge, especially as they get into the higher grades. So really having the teacher be aware that the child does need to miss some school for medical appointments, and that is just kind of it's not unavoidable. A lot of schools I'm finding have more and more online resources, especially in the higher grades, which is fantastic. And that also is really great. I'll come down to the heavy backpack. It's really difficult for children, as you know, even without any kind of issues, to lug a heavy backpack back and forth between school and home. So if they can get a second set of textbooks, have access to online resources, those are all things that we can ask for. And another one is navigating busy hallways. I don't know if you guys remember what it was like, especially in high school, when all the classes come out at once, and it's an absolute gong show. So sometimes what we've done is just say, hey, can Susie leave a few minutes early so they can get to their class on time? And also just, again, educating teachers that it might take your child a little bit longer to get between classes, especially if it's at a bigger campus. So these are issues that particularly kids in elementary school have. It's not a terribly obvious one, but story time. Story time is often in a circle on the floor. And so if your child has arthritis in an ankle or a knee or a hip, it's going to be hard for them to get up and down and even sit cross-legged. So is there an option for that child to have a chair? Or perhaps could that circle time happen all of the children in desks as well? And encouraging that risky behavior and when I say risky, I don't mean risky. What I mean is, being on the monkey bars, jumping, running, swinging, those kinds of things. Really talking to your child about what do they feel safe doing. And maybe if the child and you bring another peer on board and tell them what's happening, maybe that can be a buddy for that child to do something else with on the playground. And again, making sure that the teacher is aware of any pain issues, especially in elementary school. Younger kids don't often have the words to describe that they're in pain. And so often they'll have these behaviors that look like they're being disruptive or distracted, but in fact it's because they're wiggling in their seat because they're in so much pain. So things like, again, stretch breaks or standing up are helpful. This one is kind of a bugaboo of mine, but the indoor-outdoor shoe issue. If they have orthotics and they have laces in their shoes, trying to switch back and forth between indoor and outdoor shoes is a real challenge. So even just asking for them to keep on the same pair of shoes. We spoke about assignments. Again, this is high school. It's a lot of increased volume of written output. So again, asking for a laptop or a tablet. And in some teachers have actually said, and I don't know, I can speak to the panel after, but that sometimes some of the curriculum can actually be modified because there's a lot of stuff that's in there that perhaps is not extra, but is perhaps non-examinable. And sometimes even coloring maps. It's amazing to me that so many kids in grade 11 and 12 are coloring these detailed maps when they've got terrible arthritis in their fingers. So there are different, mindfulness is a term a lot of you have heard of. There definitely are apps that are available. Here's a MindShift app. Anxiety BC is a great website that has some really great resources for children if they struggle with anxiety, which is really common with our patient group. And actually, we'll just speak to this briefly. So for university, every university campus will have an accessibility department or office. And so that's really key for your child to take their documentation in advance, even if they don't have active disease, because it's really hard to back the truck up and get things in place, because they have so many students, obviously, to deal with. And also just choosing a class schedule that works for you. You obviously have more flexibility in terms of what you're able to do in university. Okay.
Can you hear me? There we go. A tech exam there. For me, I think the most common thing I see is that most people don't understand that a child with arthritis symptoms can vary from day to day. So one day the child may participate in PE and feel great and be able to keep up with all the kids. The next day they're really sore and they're not able to, or maybe they're having some trouble in class. And that seems to be really challenging for people to understand, the fluctuating symptoms. And that can be really hard on kids because they can sometimes be felt to be not trying hard enough or not participating fully, when really their symptoms just can vary, and that's not obvious to another observer. So education is a big part of what we do when we send the school letter.
Just to add on to that, for me, I'd say just a general lack of understanding from teachers about what arthritis really is. Joint pain, stiffness, they kind of think it's minor symptoms, as well as the medical appointments that are associated with having arthritis, how often a child is absent from school, side effects from medications if they're not feeling well, they have to be absent for a full day for an infusion. So I think it's really important to communicate as a parent with your teachers to let
the only thing that's coming to my mind right now is that advocating for your child and sharing all that information and essentially teaching the teacher, you'll end up doing that every year. So being proactive and ensuring that you share with the teacher at the beginning of the year and you have that meeting, but at the end of the year, do some reminders, provide some literature, because that teacher participates in what we call articulation, and they're sharing that information across so that when you arrive that following September for your new teacher, and you'll say, this is because they should be going, oh yes, that's right. So those kinds of things, just to be proactive, can help with those transitions, and even more so, moving from elementary to middle or junior and middle to high school.
Testing? Yes. So I think following on from what all of these ladies have said, one of the big things is just really advocating for your child, and also as they progress into middle school and senior school, advocating for themselves more as well. Awareness for the teachers so that they can make the appropriate accommodations. And we're always very happy to write letters to school to recommend these accommodations, particularly around for the older children. I know there's always a lot of stress around exams and assignments, so we can surely advocate for extensions, particularly when there's a lot of missed school days as well. So I think that's one of the big things, is the stress around these academic demands that they don't want to be missing out on as well. So we can really help advocate for that.
Great, thank you. So my next question is around what...
Right. So in terms of working with an OT, that documentation would come into the school, and then it would be forwarded, in my case, and I can only speak from my experience with my board, it goes to our board and in line with, I think, the hospital, and those kinds of supports can come in for an OT. For other supports within the building, they often start with the term accommodations. What accommodations can be made for my child? And the good news is that the sort of thinking and work that's gone into our revised curriculum has been around personalized learning and inclusive education, which means that making sure that we're meeting kids where they're at. So in this case, when you come into the teacher and you're talking about things that your child needs, be it something from your OT, a different pencil grip, more time to write examinations or shorter amounts of homework, the list is quite long. And I think when you go in to talk about those accommodations, that's the term you would use. If you need more, I wouldn't hesitate to speak to the teacher first, and if if the child has a great deal of accommodations needed, you can ask for a school-based team meeting. They're called SBT, school-based team, and that's when it involves perhaps not just the one teacher your child sees, like in middle school, it can be more than one teacher. There's also what we have in many schools are student services leads or the case managers for students that have accommodations. And so that person gets involved and the administration gets involved. So now you have more voices, more people in the room who are looking into managing those accommodations that need to be made for your child. Trying to think, there was something else I was going to say, it's gone.
Okay, well, if you think of it.
Oh, okay, so an IEP is an individualized education plan that gets put together by your student services or case manager in that case. The health category, which is a category D, if you're interested or trying to find out more information on this, I would say it's used for more severe cases. So if your child is stiff in the morning, needs more time doing stuff, this isn't necessarily where you would go for a category D. But in the case of a category D, you can actually find the checklist on the Ministry of Education website. So this is a BC government process. And you can see the checklist. It requires documentation from BC Children's. And then it goes usually to the board or the district head office for final determination in terms of funding. The funding then would be provided, and what it gives you is a case manager in the building who's going to write that education plan, which would be goals for your child. That doesn't mean that if you don't have an IEP, you're not going to have the same kind of accommodations and goals for your child put in place as you work with your classroom teacher. It's not one or the other. But an IEP can be provided for more severe chronic health issues, and that's very, very specific to every child that's involved. I don't know.
Thank you.
I think the first most important one is that teaching the teachers. I mean, they just, in all honesty, don't know. And a lot of times you have to spend a great amount of time and coming in prepared with information and documentation and understanding of what this diagnosis means for this child. And I also think it would take time for the development of those accommodations to make sense for everybody. So as you move through the school system, and I know all of you are probably in different places in the school system, you get better at navigating that system. But the most important piece, if I say anything, is teaching those teachers and providing that information and creating a really a working relationship starts early in the year. Don't wait for something to happen. Don't wait for, your child's coming home crying. It's really important you get in ahead of time so that it stays a positive experience.
So there's many children, not just with arthritis, but who have other chronic conditions that have difficulty accessing OT in school or PT in school, for example. There's not very many, and depending on which district your child goes to school, and prioritizing that is difficult for administrators, but I think lack of resources is a big challenge. And because we try to be quite specific in our letters to the school for recommendations, so that's part of the teaching and educating part. But it's challenging to have them implemented if the school doesn't have the resources.
Or announcing to your teacher that you may need accommodations at school. A lot of patients might not be comfortable with that. They might not want their classmates to know that they might need a little extra help in class. But I think it's really important to remember that your end goal is to be able to achieve at school, to reach your career and educational goals. And those accommodations can be something that can be very helpful for your child as they progress and helpful as they continue on from junior high to high school. So I think that's a barrier as a patient really, is just kind of overcoming the fact that, you do need a little bit of extra help, and that's okay because it's just putting you at a level playing ground with everyone else in the classroom. And you know what, having to use a laptop or different accommodations, it's really not something that a lot of people are going to notice in the class. They probably don't even care. So just kind of getting over that barrier and just knowing that it will help you. And just an idea of some of the resources that are available technology-wise. In high school, I was given access to an iPad that was provided by the school. It was really good to carry around because it was lightweight. You could download your textbooks on it. And moving on to university, the school actually provided me with a lightweight MacBook laptop that had Dragon dictation on it, so you could speak directly into the laptop. And that was just a lot easier to use than trying to write into notebooks. So there is resources out there, and as you get older, there is assistive technology grants and funding that can be provided by the schools. You just have to dig for it a little bit.
Great. Thank you.
To educate the students and the teachers as well on JIA. I think that's an excellent initiative, and I think that's a great way because it makes it engaging. It'll be in a way that the students understand and they'll remember it as well, and it can be something that then can be inclusive for all of the class. So I think that is, a really big one. That's a real good takeaway from today.
And I'll just speak a bit more to that. So the program is called Came In, and it's meant to be for the younger grades, I think up to grade 4. But it's they've just redone the script, and it's really great. And it just is meant to, in a really accessible way, educate your child's peers about what their daily life and what their challenges can be. It's a really excellent program. So if you're interested, approach Cassie and Friends about getting that to your child's school. Anyone else? Sorry.
Do we have information on a literature that parents can take? Do you have that? Yeah.
Yes. So if you need documentation, there are these great.
And she told me that it's kind of a 50-50 chance that it has to do with either the arthritis or the medication, or she could just be one of those kids that has really, really bad concentration. I guess my question is, how do I know which it is? It does make a difference to me because she seems to be the only one that struggles like this in her class, and I can see it starting to affect her confidence. So how do I know, and what else can I do to make her feel better about it?
So it would be good for your child to have a psychoeducational assessment. And some people have quite severe disease activity measured by swollen joints or limited range of motion of joints, but they don't complain of very much pain, and they seem to function quite well in their daily activities. Other children don't appear to have any active inflammation, either by imaging or by physical exam, but they're still really tired. So pain and fatigue are complex, they're subjective. So many things factor into them that there's not a really great correlation.
I just started thinking that she complains of it to me, she needs to rest. I'm starting to think maybe that's her way of saying I'm tired because of my arthritis. It feels real to me.
Yeah, I mean, kids will express fatigue in different ways, and will express discomfort, whether it's physical or sort of psychological anxiety in different ways. You know, some of us get headaches when we're upset, or stomach aches when we're upset or tired. Everybody's a bit different, so learning the way your child presents is important. And certainly methotrexate can make kids feel tired.
Also, with the methotrexate in school, if you're experiencing symptoms of nausea or the stomach aches, kind of what I did was take it on the Friday.
I ended up rushing up there at lunch, on my lunch, from one school to the next to do it. Schools, there becomes issues with administration of medication. We can't do it. So yeah, it gets tricky. As soon as my daughter Kaden could put her drops in herself, it got better, or we tried to manage the hours of time when they could be put in to right after school, and something that worked better for the family. But it was a real tricky piece for us to manage for a while. Yeah.
So the answer is you just have to do it.
Yeah, you do. There are, I mean, in my district and certainly in the Lower Mainland, I think the school nurses just don't exist. Yeah. Yeah. If there are other parents available, like I'm thinking the school would be comfortable for having another person that you deem capable of giving the drops as well, right? It just can't be a school personnel. And that could just be my district, so I don't know what district you're in, but I know that's how it is in ours.
Just on that question, even if we're doing the first aid and
They're not. Yeah. Yeah. It's just a piece that we can't do. And those first aid people, and speaking from my district only, the first aid people are technically there for teacher first aid, but they do work with the children just because that is who gets hurt every day. But yeah.
I was just going to add to that from the rheumatology team perspective, we like to know if your child is on a lot of drops as well, because sometimes we can escalate therapy in different ways, which may not always be desired, but it's not practical for children to be on drops every hour. So for example, sometimes we'll see kids who are on drops 6 times a day, and you just know that's not happening. And it may be that if we change medications, we can come down on the drops to something more manageable for the family.
And I may just comment too, if your child is old enough to administer their own drops, but say has a lot of arthritis and pain in their fingers and can't quite make the dropper work, there are adaptations that can be made to that. So that's something that you would bring to Sarah, and she could help you work on that.
Problems last year at school, and we actually tracked them. I talked to his teacher who kept complaining that your son lacks concentration midday, he's very tired and isn't paying attention and he's just distracting the class. It turned out he was doing English and then math once we started tracking what time of day he was getting really distracted and being disruptive. Those 2 classes back to back were too much for him, and the arthritis and all the writing and the measuring and the moving around. Once we modified his class, the distraction level and the concentration level went up, and math was his favorite, and he was failing it. He was failing math last year because he couldn't concentrate because they made him do English right before and reading and a lot of writing and stuff, and then do math, and by the time he got to the math, he was just finished. So if you talk to your teacher, maybe track and figure out what class they're doing or what they're doing or what time of the day. So my conversation was to her, well, you're telling me he's distracted. Can you tell me what time of the day and what you're doing? So she said, well, we'll track him. So we start tracking him, and that's how we figured out it was only certain times of the day.
So you were a detective.
Like that idea of he's distracting the classroom or he's doing this. So really coming back and saying, well, that's not him. If we're looking at pain behavior, what are the things that are taking on, and what can you do? And putting that back on the teacher and saying, that's what can you do to shift your, the way you're addressing that. Because for the first few years, especially in the younger grades, it was coming back as a deficit in him, and that's something I really wanted to stay away from, which we didn't manage. He came out of grade 2 with seeing himself with a deficit because of this always coming back on him. So something I work really hard on is correcting that language right away, is saying that's not the language we're going to use to talk about this. If you want to speak about pain behavior, then we'll speak about pain behavior, but I don't want to hear he is distracting the classroom or he's being disruptive. So I think that's something really important to think of when we're going into the classroom and having these conversations with the teachers and admin, that it's not cycled back on your child.
Good point. Thank you.
Sitting on the floor and cross-legged, and sometimes that's hard. When you involve more minds in creating the solutions, for example, that could be, it isn't just a cushy chair or a milk crate with a cushion for one student, but they now have flexible seating for more than one student, so it isn't just your child. But those kinds of solutions and that positive mindset, those are things that, it kind of comes out of situation, and we have to be a little more creative in our thinking to work with this. So coming into those meetings with your teacher, knowing that you want to make this a team approach, making sure you have everything as much as you possibly can kind of written down, but written in such a way so that you're working as a team to find these creative solutions and make it work for your child.
And I think I just kind of wanted to add on to the positive mindset overall. We've discussed a lot of challenges that patients with childhood arthritis can experience. I think it's also important to remember that your children are still able to be successful in school as they progress. So just keep that in mind, that just because they have these challenges and these accommodations doesn't mean that they need to fall behind in class or have poor grades. They can still succeed academically and make it on to university. So just keep that in mind. And one thing that we haven't really touched on is having conversations with their friends or their classmates. In my research study, we actually found that most patients weren't telling their classmates about their disease, which is fine if they like to keep it private. And a few more were telling their peers. But it's important to keep in mind encouraging your child to develop at least a few strong peer relationships and people that they can trust within their class to help them at school, whether that be things like taking their notes, helping them carry their bag, or just being someone that understands them on their day-to-day. So just think of extending these conversations not only with your child's teachers, but also with their friends as well.
Sorry, and I just want to reinforce that piece of when your child is transitioning, be it from one grade to the next, getting in there in the May. May is a really good month for going in and making sure that the information you need transferred either to the next teacher or to the next school. That's your best timing. Don't wait till the end, and don't wait until something kind of occurs. It's really important to get in there and advocate ahead of time, and for those articulation processes where teachers begin talking to where your child is going. Also know that in terms of where your child is in the building, those decisions are also made well in advance.
They just feel welcome and they want to help you because you ask them. It's really helpful.